UK and hospitals struggle to cope. We speak to a leading epidemiologist about a fast-spreading variant of the virus.
Search and rescue operations continue in Croatia after a strong and deadly earthquake. We'll have more details in the Cube.
Dublin promises to pay for Northern Ireland to stay in the Erasmus scheme. A leading Irish politician tells us there's no ulterior motive to this pledge. And from mollusks, mosses, sponges to corals, 12 new species are discovered dwelling deep down on the ocean floor. Hello and welcome to the programme. Well, the UK faces unprecedented levels of COVID-19 infections, with health officials are calling a matter of extreme concern. The country has reported 53,000 new cases of coronavirus, shattering the previous record high of 41,000. With pressure mounting on the government to introduce tougher measures, the health minister is expected to announce adjustments to England's tier system on Wednesday. The UK has the second worst death toll in Europe. 71,000 people have died from COVID-19 since the pandemic began. The National Health Service is struggling to cope with the new surge of infections. A record 21,000 people are in hospital with COVID-19, breaking the previous record set in April. In the worst-hit areas of London and the south of England, ambulances have reportedly been left waiting hours before patients are admitted. Russia's coronavirus death toll has jumped to over 100,000, nearly double the number previously recorded. The count has been updated to include cases where the virus was not the main cause of death and where the virus was suspected but not confirmed. The early rollout of the AstraZeneca Oxford University COVID-19 vaccine in Europe has been dealt a blow, as the European Medicines Agency says it's unlikely to be approved in January. The EMA's Deputy Director, Noël Wattion, says he hasn't received an application from pharma giant and that the information on the jab is limited. The drug maker has submitted a full data package about its vaccine to British regulators, who plan to roll it out from the 4th of January. Now, the health situation across Europe isn't helped by a more infectious variant of the coronavirus that's spread to several parts of the continent. Dozens of countries have closed their borders to the UK, where it was first detected. Well, to break down how it could affect Europe's response to the pandemic, we're joined by Dr. Bharat Pankhia from University of Exeter Medical School. Good evening to you. Many thanks for joining us on the programme. So, as we look to this new variant of COVID-19, is it possible to ascertain now whether the vaccines that are being developed are going to be effective against it?
Oh, on the subject of the vaccines, I'm very confident that whatever the variant is, we will be able to create the right spike protein, to create the right immunity to be effective. So on that count, I'm very confident. And even if the vaccines have to be reformulated because the spike protein is so different from the original version, we can still do it. I'm very confident about that.
Okay, but given that this is spreading so fast, and if it does, we do end up in this situation where vaccines do have to be reformulated, how long does that take, and what impact do you think this very fast-spreading variant could therefore have?
Well, I would like to reassure our viewers and listeners that it is highly unlikely that you would have to reformulate your vaccine. And that's the key message. If you had to, it is just a production line matter, and it isn't a case of weeks and months away. It is simply changing the code if you had to. But I repeat again, highly unlikely that we would have to reformulate the vaccines.
It spreads faster. Is this variant more severe?
Yes, so again, in answer to your question, luckily this variant is not more severe disease causing. And on the subject of it is more infectious, I like to say maybe. We still need to see the real evidence that it is more infectious. It may be so. What we have to bear in mind is we've entered the colder months, so we change our human behaviors by being more indoors. And then we have the Christmas shopping and all that interactions in crowded places, closeness to other people and indoors. And all those parameters are also causes of increase in number of cases. We mustn't forget that.
And then we understand that viruses do have variants and mutations, but this one does appear to be highly unusual in the number of mutations it does that. Does that set any alarm bells ringing for you?
Well, the alarm bells that were set is that it had multiple mutations over a short period of time. And the reason why people are postulating that it may be more infectious is because the mutations, or some of them, were also in the region where it attaches to the human receptors, and hence the summation that as a result of those mutations, it may have become more infectious. So what has probably happened is we've had several generations of virus happen in maybe an immune suppressed patient. And as a result, this new variant, new branch of the SARS-CoV-2 virus has emerged.
And then just finally, what do you think authorities should be doing in the UK, but also in the EU, faced with this new variant? Is a third lockdown on the cards, in your opinion?
I'm so sorry to say, but I think another shutdown is very much on the cards. Speaking for the United Kingdom, we have over 50,000 new cases today. Our hospitals are full. And with that rising number of cases, unfortunately, we would have to bring in human restrictions. What I would advise is you keep your infection control measures up to date. And if you don't get infected, you don't generate new cases. And that is the best thing you can do until the vaccines are deployed.
Okay, well, Dr. Bharat Pankia, we really very much appreciate your time.
Thank you.
Now, a deadly 6.
Thank you very much.
Thank you. Bye.